Today, we'll be discussing a condition known as endometriosis, which affects many women around the world. Millions of women live with endometriosis, a condition often called the silent pain, yet many go undiagnosed for years. Today, we'll explain what endometriosis really is, why it's so hard to detect, and what treatments are available. First, let's start with the basics. What exactly is endometriosis? Endometriosis happens when tissue similar to the lining of the uterus grows outside it. This tissue, called endometrial tissue, can grow on ovaries, fallopian tubes, and even other organs. Each month, this tissue behaves like the uterine lining. It thickens, breaks down, and bleeds. But unlike normal periods, this blood has nowhere to go. Instead, it causes pain, inflammation, and sometimes scarring. What are the common symptoms of endometriosis? Symptoms vary but can be severe. They can include painful periods, sometimes crippling pelvic pain outside periods, pain during sex, heavy bleeding, and struggles with infertility. Fatigue, bloating, and nausea are also common. The challenge is that these symptoms are often mistaken for regular menstrual pain, delaying diagnosis. On average, it takes 7 to 10 years for a woman to be diagnosed with the condition. Why does it take so long? Because symptoms overlap with other conditions like irritable bowel syndrome or pelvic inflammatory disease. Many women are told their pain is normal, or they re-told it is all in their head. This leads to frustration, delayed care, and unnecessary suffering. If you think you might have endometriosis, talk to your healthcare provider. They'll ask about your symptoms, perform a pelvic exam, and may order imaging tests like an ultrasound or MRI. In some cases, a laparoscopy may be necessary to visually identify the condition. As mentioned earlier, the symptoms of endometriosis often mimic those of other conditions, making it tricky to pinpoint the actual cause of the pain. Additionally, endometriosis can manifest differently in different individuals. While some experience minimal symptoms, others suffer greatly. This variability makes it challenging to establish a uniform diagnostic approach. Furthermore, the pelvic region where endometriosis occurs is not easily accessible for direct observation. This means that healthcare providers must rely on a combination of physical exams, imaging techniques, and patient history to make a diagnosis, which can be a slow and sometimes frustrating process. While the exact cause of endometriosis remains uncertain, several theories and contributing factors have been proposed. One leading theory is retrograde menstruation. This occurs when menstrual blood flows backward into the pelvis instead of exiting the body. Over time, this blood can pool in the pelvis and come into contact with the ovaries, fallopian tubes, and other pelvic organs. The endometrial tissue exposed to this blood can then begin to grow and develop, leading to the formation of endometrial implants. Another factor that might play a role is genetic predisposition. Research suggests that endometriosis tends to affect women who have a family history of the condition. Studies have identified certain genes that may be associated with an increased risk of developing endometriosis. However, it's important to note that having these genes does not guarantee that a person will develop the condition. The immune system also plays a significant role in the development of endometriosis. A properly functioning immune system is crucial for preventing and eliminating endometrial tissue that grows outside the uterus. However, when the immune system is compromised or dysfunctional, it may fail to recognize and eliminate these endometrial implants, allowing them to grow and thrive. Hormonal imbalances can also contribute to the growth and development of endometriosis. Certain hormones, particularly estrogen, play a role in the growth and behavior of endometrial tissue. An imbalance in hormone levels, such as higher than normal estrogen levels, can promote the growth of endometrial tissue outside the uterus, leading to the progression of the condition. Additionally, environmental factors may also play a role in the development of endometriosis. Exposure to certain chemicals or toxins has been linked to an increased risk of the condition. These factors can disrupt the normal function of the reproductive system and contribute to the development of endometriosis. Several conditions and situations have been associated with an increased risk of endometriosis. First, women who experience heavy menstrual bleeding or prolonged cycles are at a higher risk of developing the condition. Second, Women with a history of pelvic surgery or multiple pregnancies are also at an elevated risk. Third, infertility struggles. Women facing infertility issues are often found to have endometriosis as a contributing factor. Fourth, women who use barrier methods of contraception, such as diaphragms or sponges, may have a slightly increased risk. Finally, women with a family history of endometriosis are at a higher risk because of genetic factors involved. How does endometriosis impact a person's fertility? Endometriosis can significantly impact a person's fertility. The scarring and inflammation caused by endometriosis can lead to the formation of adhesions, which are fibrous bands that can obstruct or distort the path of the fallopian tubes. This can hinder the movement of the egg and sperm, making it difficult for them to meet up, or for an embryo to implant in the uterus. Additionally, the endometrial tissue that grows outside the uterus may also produce an unfavorable environment for implantation. This can further complicate the process of conception and pregnancy. As a result, women with endometriosis often face challenges and may require assisted reproductive technologies like in vitro fertilization to conceive. Now that we know the risks and challenges, what are the available treatment options for managing endometriosis? Treatment options for endometriosis aim to alleviate symptoms and improve quality of life. Since there is no one-size-fits-all solution, treatment plans are often personalized based on a person's specific needs and symptoms. Some common approaches include pain relievers and anti-inflammatory drugs. These medications can help reduce pain and inflammation associated with endometriosis. Hormone therapy. Various hormonal treatments are available, including birth control pills, shots, patches, or rings. These options help regulate hormones and may lessen pain and bleeding. Surgery. In some cases, surgery can be used to remove endometrial tissue or adhesions. This can provide relief, especially when other treatments aren't effective. Fertility treatments. For women struggling with infertility and endometriosis, treatments like in vitro fertilization can help achieve pregnancy. Here are some tips to help navigate the emotional challenges associated with endometriosis. Seek support groups. Connecting with others who understand your challenges can be immensely helpful. Share your experiences and learn coping strategies. Talk to a therapist. A therapist can provide a safe space to process your emotions, reduce feelings of isolation, and develop healthy coping mechanisms. Practice self-care. Prioritize activities that bring you joy and help you relax. This could include yoga, meditation, journaling, or spending time in nature. Educate yourself. Knowledge is power. Learn as much about endometriosis as you can to feel more in control and advocate for your health. Don't hesitate to ask questions or seek second opinions from healthcare providers. Advocate for your health. Be your own health advocate. If you feel your pain is not being taken seriously, seek out specialists who have experience treating endometriosis. We hope you found this information helpful. Remember, if you or someone you know is dealing with endometriosis, there is support and treatment available. Knowledge is the first step towards taking control of your health. If you enjoyed this video, please like and share it with others. Thanks for watching.